psychiatric section, and we are discussing persistent depressive disorder, which is also known as dysthymia. So it is a continuous long-term or chronic form of depression, mild or moderate considered. You may lose interest in normal daily activities, feel hopeless, lack productivity, and have low self-esteem, and an overall feeling of inadequacy. So these feelings last for years and may significantly interfere with your relationships, school, work, and again daily activities. If you have a persistent depressive disorder, you may find it hard to be joyful even on happy occasions. So you are like constantly complaining or incapable of having fun. Persistent depressive disorder is not as severe as major depression. So let's go with definition. By definition, it's a chronic disorder characterized by depressed mood that lasts most of the time during the day, so practically all the day, and is present on most days for at least 2 years. So for establishing diagnosis of major depression, you need at least 2 weeks. If you are a doctor, you should know this, and if you suspect some dysthymia in patient, you should ask about period time, and it should be at least 2 years. How about risk factors? Women younger than 64 years old from clinical resources, unmarried young individuals from low-income families, traumatic or stressful life events, have other psychiatric disorders like anxiety, substance abuse, borderline personality disorder. It starts in childhood mostly and should be encountered by adults if they observe something different in their children. Symptoms that encounter persistent depressive disorder, they are like the same with major depression but are less severe. So loss of interest in daily activities, again daily activities, and any of the activity is low, decrease in activity. Sadness, emptiness or feeling down, hopelessness, tiredness, lack of energy, low self-esteem, self-criticism or feeling incapable, trouble to concentrate or to make decisions important for life, inability or excessive anger. Decreased activity, again decreased activity, effectiveness, productivity, concentration, avoidance of social activities to interference with other people, feeling of guilt and worries over the past, poor appetite or overeating, and of course sleep problems, insomnia or hypersomnia. So it can be followed by some complications like reduced quality of life. It can change from persistent depressive disorder to the major depression, anxiety disorders, and other mood disorders. Substance abuse is also a complication. Relationship difficulties and family conflicts, problems at school and work, chronic pain, and general medical illnesses. Suicidal thoughts, of course, if it changes to the major depression, and personality disorder or other mental health disorders. Is any treatment for persistent depressive disorder? Of course, long-term individual insight-oriented psychotherapy. And if this does not work, you can change to the medication like SSRIs, tricyclic acids, and monoamine oxidase inhibitors. First line, of course, are selective serotonin reuptake inhibitors, which are prescribed as a first line and are still successful in treatment. Need at least 4 to 5 months for a full treatment, and at least 2 weeks for starting the real effect. And differential diagnosis you can make with major depression to understand if this form is severe or not enough, a minor depressive disorder, and recurrent brief depressive disorders. Thank you for your watching. Have a good time.